Hello YouTube. This is a very important video, so please stay tuned. In this video I am going to talk about mental health, specifically anyone dealing with suicidal thoughts, suicidal ideations, if you've contemplated suicide, if you have a plan, where you can go to get help, and I specifically talk about what it's like in a psych unit in a hospital. Very important information. If you ever wondered what it's like for yourself or someone else, stay tuned, please. And if you like this video, please give it a thumbs up. If you want to follow my journey and my mental health and my health in general and weight loss, please subscribe to my channel and hit that notification icon and get all the updates. But please stay tuned for more information about mental health and suicide. All right, so I was recently admitted to a psych unit at a hospital. It was not my first time in a hospital. I've been admitted a few times, so I have a little bit of an idea of what they're like. So first of all, I want to tell anyone out there, if anyone does have suicidal feelings or a plan for suicide, that there is help out there. There are options. And it's not as bad as you think. I remember my first time, I was like, oh my gosh, I'm gonna be in the nut house with a bunch of crazy people, and it's just not, it's not like you think. It's not a bunch of people walking around all crazy like. Especially if you're just dealing with suicidal feelings, and if you have a plan or have attempted and just dealing with that, you most likely will be put on a unit with other people in similar situations and that have the same type of issues that you do. They have different units for different severities of psychological problems, and normally the just emotional support and that sort of thing are on a specific unit, and so you don't have to worry about. I remember my first time when I was going in, I was like, my roommate, I'm gonna have a roommate and they're gonna come strangle me in my sleep or something like that, and I was just not prepared, and I didn't know what to expect, and that's not at all was my first experience. So you don't have to worry about that. When you first go in and admitted, when you go into the ER at a hospital, they will have you put on a gown. You have to, most places, you have to give them your cell phone, everything that you have, and you have to put on a gown. You just have your underwear underneath the gown, and you're put in either, if you've attempted suicide, for instance, in my experience was an overdose, so I was in the ER for several hours being monitored. So you're in a hospital bed being monitored. You don't have access to your cell phone or anything, any of your belongings. They take all of those when you go in, so be prepared to have your belongings taken when you get there. They take those. If you are just having suicidal thoughts, ideations, and have not acted upon those, they usually take you. Most ERs have a special intake room, not a room, but it's more of a separate part of the ER that's specific for detox and psych, where you may have your own room in there. Sometimes it's just a chair in the room and that's it. Blank walls, just a chair, but you can wander out through the hall there. Sometimes there's maybe a little TV room inside that unit, and this is all still in the ER. You may find where you can, walk around and wait to get assessed. What they will do is you'll meet with a doctor, let them know your situation, let them know, hey, I'm feeling suicidal. Yes, I did have a plan for it. I was feeling about acting out in this manner or that manner. You'll meet with a doctor, a nurse, and then most of the time you'll meet with some sort of case manager. It could be from a local mental health clinic or in the community, some kind of community health boards that come out and assess you. And they will ask you all kinds of questions, how you're feeling, what your plan was, all that kind of stuff. They'll ask you basically a series of questions to assess your level of suicidal thinking and how, if they determine that you are a danger to yourself or others. They'll ask you if you're seeing things, hearing things, that sort of thing. If they deem you not a danger to yourself and you just came in with a suicidal thought and you're okay, they'll send you home straight from the ER. However, if they deem you a danger to yourself, they can admit you into the psych unit of that particular hospital if they have beds, or transport you to another hospital, or a special psych hospital that does only psychiatric care, depending on your needs. I've done both. The one part you should be aware of, if you do get admitted into a psych unit, they do what's called a skin check. Every hospital does this. You have to take off all your clothes but your underwear. They check out your skin, seeing if you have any cuts, bruises, anything like that. Depending where you are, some of these are more in-depth than others. Most of them, you're in your underwear and you have your shirt off, your pants off, you're just in your underwear. They check out your skin. They may peek inside to look at your butt. They did that to me. I have also had where they've had me take my underwear completely down, take them completely off, and check me out that way. So be prepared. That is normal. That is part of it. That's just, I'm not sure why they do it. I guess to make sure your skin is free. So if you have any cuts or in there, they know that those were there beforehand. I guess it's just for safety. While you're in there, you will have access to telephones. So not your own cell phone. You never get that while you're in there. If you plan on being admitted, bring a couple changes of clothes. Probably no more than 2 to 3 changes of clothes. A typical stay might be 5 to 7 days, and bring a few changes of clothes. They do have washers and dryers, so you can do your laundry, whether that's the staff doing your laundry or you're doing the laundry in there. You have access to that. Telephones access is usually limited to certain times of the day. Normally they have groups throughout the day. If you're in kind of a not so good of a unit, they might have 1 to 2 groups a day. They're about an hour long each. They talk about mindfulness, they talk about coping skills, all kinds of different skills you can utilize to set yourself emotionally correct when you're dealing with suicidal thoughts or dealing with stress or anxiety or depression. Different ways you can cope with those besides medication. You will see a doctor every single day. They will put you on whatever medication that they deem necessary. In my case, they have taken me off of all the benzos, so your Xanax, your lorazepam, all that kind of stuff. Since I've overdosed several times, I don't get prescribed those. That is not the case everywhere. If somebody tells you, oh, you can't get Klonopin, you can't get Xanax, that's not true. They do have those, but they are very, very wary of giving those out nowadays for obvious reasons, for the addiction and everything. They're just not good for long-term use. So someone who's got chronic anxiety, expected to have that the duration of their life, they're just not good for that due to the addictive properties. But anyway, that's beside the point. So you will meet with a doctor. The better hospitals that I've been in, they'll have, for instance, like pet therapy. You might have a dog that comes in. You have art therapy, draw pictures, paintings and stuff, and talk about how the art relates to mental health. They have movie. I have one even call it cinetherapy, which I thought was like, okay, that's kind of off the wall. We're just watching a movie. But anyway, the art therapy, activity therapy, some of them even have. We had, in this one I was in recently, we had yoga, meditation, that sort of thing. And, but really, the best part about the hospital, in my opinion, besides the groups that you attend, that you will get, if you put you get out of it what you put into it. If you take it seriously and want to get help, you can get a lot about the groups, but you can get a lot out of the groups. But the best part is the camaraderie, the talking to other people that have the same situation as you, that are in the same boat, that have dealt with the same issues. You are not alone. And you really begin to realize that the first time you get admitted to a psych unit. You will find that you will meet people that have the same exact issues that you do. and you can talk to them and you can interact with them, and it's really, really good. I've met people in the hospital that I'm still friends with. Most hospitals recommend you don't keep in contact with people you meet there, but there's really nothing they can do about it if you get somebody's number and develop a friendship with them. I do have friends that I still talk to that I've met in the hospital. It's not always a good idea. Like I said, not always recommended. I have had one bad experience of meeting a person in the hospital and then meeting up with them after. I won't go into detail about that. Let's just say it was a bad experience, and I don't contact with that person anymore. So just be aware of that. Make friends, be cordial, but don't get attached, and definitely don't make plans to move in with somebody from a hospital. I would stay away from that. People there talk about it, and that happens, but from what I've heard from staff is that those situations do not work out. You don't know what these other people are dealing with. You know, they tell you certain things and you just don't know. It's just not a good idea. Depending where you go, the food might be good, might be bad. Some places are better than others. Some even have cafeterias where you can leave the unit, go down to this cafeteria style. They have salad bars, things like that. Smoking, that's the other thing. If you smoke, be prepared not to smoke for the duration while you're there. It's a hospital. You're not allowed to smoke. There is one hospital I've been in Provo, Utah, of all places, that does have a smoking area outside, but that is very, very rare, and they allowed you to go out a couple times a day and smoke. But that is very, very rare. They will, however, offer nicotine patches that you can put on while you're there to help curb some of the cravings for nicotine. But be prepared for that. But really, my overall view here is it's not as bad as you think it's going to be your first time. Usually, when you're first admitted, you just want to withdraw. You want to be by yourself. You don't. I remember my first time, I didn't want to go to groups. I didn't want to be there. You can, if you get admitted, here in Virginia, they call it like a pink slip, where they actually deem you a danger to yourself and can forcibly admit you to a hospital. It's a mandatory 72-hour hold, and then you have to see a judge and a professional doctor to get released. Another thing to be aware of: if you go into a hospital voluntarily, without a pink slip, anything, you can't just say, hey, I came in voluntary, I'm out of here voluntarily. Doesn't work that way. Be prepared for that, because I tried it. I've seen it happen a lot of times in the hospital. If let's say you're there for a couple days and you're like, dude, this sucks, I'm not getting anything out of it, I'm anxious, I want a cigarette, or whatever the case may be, I'm not recommending you leave, I'm recommending you get the help. But if you do want to leave and you do feel that's the best option for you, the process goes as like this. If you want to leave, and this is only if you came in voluntarily. If you come in voluntarily, you tell the staff, the nurses, hey, I want to leave. They have to bring in someone to assess you, a professional counselor, just like when you were admitted. They will have someone come assess you. If that person deems you ready to leave, at that point you can leave. So from the time you say, I want to leave, it might be several hours that you're waiting for someone to come in and assess you and then deem you ready to leave. However, if that person deems you a danger to yourself, it's all up to that person, then they will so that counselor, that person, if they deem you a danger to yourself and not ready to leave, they will keep you there. And you at that point will be there involuntarily. They will commit you and make you stay there. Like I said, it's in Virginia. In most places, it's a 72-hour minimum hold from that point. And also, if you get admitted that way, involuntarily, it's a minimum of 72 hours. So be prepared for that. It is a good experience. My first time going in was, well, for the first 2 days, it was hell on earth. I hated it. Every minute of it. I was anxious. Like I said, I didn't want to go to groups. I was very withdrawn. But then I said, well, you know, I'm stuck here. I'm going to do what I can to get better. And so I started paying attention. I started talking to people. And by the end of the 7 days I was there, it was a real positive experience. And I've been back. I've fluctuated with my mental health and been in several times since then. And so I speak from experience when I say this, and I hope you've been able to listen to this entire video, because it is some good information, especially for someone who has never been, who is contemplating getting help. Please get help. There is help available. There's caring people. All the staff is different. Some people, you know, you may not have as friendly staff. I've been in hospitals where I actually hated the experience. The staff was no good. They only had like 1 or 2 groups a day, and it was very boring the rest of the day. So be prepared. If you like to read or draw, just bring things. You can bring coloring books. You know, bring something to occupy your time. They won't let you have electronics, so that's a no-no. But most places do have games, puzzles, things like that. But it's fairly boring. Like I said, the entertainment that you get is the interaction and the camaraderie with the people there. That is, in my opinion, the best source of getting better, is talking to other people and getting their input and even their coping skills. You might learn something that you didn't know. So anyway, if you have any questions, if you have any comments about the psych unit, please leave a question below. I will do my best to answer everybody's question. This is a really important topic to me, and I've been through it many times, and I know what I'm talking about. So please leave me some questions. Please leave me some comments, and let's get the information out there about going into the hospital, because it's really not as crazy and wacko as everyone, you know, as you see on TV. People aren't walking around in straitjackets and stuff like that. It's just not like that. So anyway, I hope you enjoyed this video. If you do like it, give it a thumbs up. And if you want to hear more about my mental health, my journey in health and happiness, please subscribe to my channel. And I hope everyone's staying healthy and happy. Have a great day.